Thank you all, and thank you very much, Mitali, for your kind invitation and your kind introduction. And many thanks to IFA for organizing this program and providing us with the opportunity to participate and share some thoughts with the audience today. Can I just check that you can all see my screen, my slides? All right? Okay. Thank you very much. So today I would like to share some thoughts with you and some of the work of FIP in the area of on the topic of healthcare providers as advocates for vaccination policy, and focus on pharmacist-led advocacy, which is a lot of what we do at FIP in multiple areas, including the role that pharmacists can play in vaccination services. So let me just be mindful of time. So yeah, okay. So just a brief introduction for those of you who might not be very familiar with FIP. We are the International Pharmaceutical Federation. It's an organization that was set up in 1912, and it's a global federation of national associations of pharmacists, pharmaceutical scientists, and also pharmacy educators from over 110 countries. We have a total of 156 national organizations. And one of the areas in which FIP is advocating where pharmacists can play a big role is precisely the area of vaccination throughout the life course. And based on a conviction that vaccines save lives, they protect healthy living and quality of life, and functional ability and well-being across all ages. And therefore, we need to provide pathways and facilitate the vaccination processes to drive vaccine uptake across all ages, and not only all ages, but also all population groups that may have a special need or may benefit the most from vaccinations and being vaccinated, including people with underlying comorbidities and non-communicable diseases, pregnant individuals, or immunocompromised individuals as well. And what we do know around the world is that childhood vaccination is very well established and has, in general, in most countries, very high coverage rates. And there's the targets there for childhood vaccination established by the World Health Organization and other bodies are generally around 90% higher, and they are roughly achieved in most countries. However, even though we do have effective and safe vaccines that are targeted at other age groups, in particular older adults, we see that the targets there are lower than those for childhood. And that's something that we believe that needs to be reviewed and updated in terms of equity, achieving of equitable targets for older adults and across the life course. So this need to drive and impulse and promote vaccination across all ages is recognized in some of the key global health policy agendas, including some examples that I would like to cite now, including the World Health Organization's Immunization Agenda 2030, which was adopted in 2020, or to cover this decade from 2020 to 2030, a global strategy to leave no one behind. And this document includes some key strategic objectives that member states of WHO are encouraged to transpose to their national strategies and immunization programs, including that everyone is protected by full immunization regardless of location, age, socioeconomic status, or gender-related barriers, and also that all people benefit from the recommended immunizations throughout life, effectively integrated with other essential health services. Another document that supports access to improved vaccination and generally to a bigger role of primary healthcare in health systems is the Declaration of Astana, adopted by WHO and its member states in 2018 to revamp the role that primary healthcare plays in health management and healthcare. And the three principles that this documenting highlights include integrated health services to meet people's health needs throughout their life, but also empowering individuals, families, and communities to take charge of their own health. And this can only be done with empowered literacy as well, and understanding the benefits of interventions such as vaccination, and also addressing the wider determinants of health through multi-sectoral policies and actions. And this includes developing appropriate and multi-professional vaccination pathways to facilitate access to vaccines and vaccination services. Another key document and global health agenda is the UN Decade of Healthy Aging, which clearly highlights the need for a life course vaccination as the pillar of healthy aging and the preservation of functionality at all stages. So when we consider these global health agendas and documents, we as pharmacists and FIP think that we can be part of the solution. And indeed, we know that we are part of the solution in many countries around. So FIP, one of our priority programs of action is precisely the prevention, disease prevention program and our advocacy on vaccination. And to align our work, not only in that program, but in general, the work of FIP, and to provide guidance to our member organizations, FIP developed a set of the FIP development goals that are aligned with the United Nations Sustainable Development Goals and provide a framework for the development of the pharmacy profession in these 21 dimensions that you can see that include people-centered care, communicable diseases, AMR and AMS, access to medicines, and many other that you can see on the screen, patient safety. And we see that pharmacy-based vaccination and vaccination-related services are overtly linked to 14 of the 21 development goals, pharmacists, and have a central role in 8 of them, including communicable diseases, of course, the prevention. This is the most obvious one. And this is where also pharmacists can play a big role in direct prevention of communicable diseases, but also vaccination is clearly linked. Vaccination at pharmacies is clearly linked to integration of healthcare services across multiple providers and the need to develop solutions to achieve this integration. Also policy development, because this needs to be embedded in policy, including vaccination programs, strategies, and how vaccination services are delivered and funded at country level. Also, people-centered care, which is our development goal that is mostly linked to non-communicable diseases, precisely because of the increased need for vaccination that people living with non-communicable diseases experience. The contribution of vaccination to antimicrobial stewardship and the prevention of AMR, of the emergence of AMR, but also improving access to medicine services and devices. Digital health in terms of accessing vaccination registries and being able to register vaccinations provided by pharmacies at those registries. And finally, but certainly not least, ensuring equity and equality in vaccination services and reaching out to those that need the most. And we see that some of the factors that affect access to health and access to health care are also factors that affect access to vaccinations or provide or represent specific challenges that need to be addressed. One of them is age, precisely how people, our older adults, can access these services in the easiest and most accessible conditions as well, and that the services are developed precisely with this population group in mind. Also, people with underlying diseases and comorbidities, the gender barriers in access to healthcare and to vaccination services as well, and in particular, addressing the needs of pregnant individuals in access to vaccination. Also, issues of literacy and access to education, which have a direct impact in vaccine confidence and also concerns about vaccination, and several other factors through a logic of intersectionality, of course. So FIP has been developing a series of resources, strategic plans, and and policies to support the work of our member organizations at country level to advance the role of pharmacists in improving vaccination services. And we started this in 2011, already 12 years ago, in a document that we co-developed with the World Health Organization, which were the good pharmacy practice standards of quality for pharmacy services. And this document already described the role that pharmacists play in the administration of medicines by injection, including vaccines. And since then, in 2016, we conducted our first global survey on the role of pharmacists in vaccination, and we have been developing such surveys and developing other resources and providing guidance in a variety of formats. And I won't take your time in describing all the resources that have been developed, but just to highlight some of the types of materials that we have developed. These include professional guidance and handbooks on procedures and safety aspects and common risk factors for pharmacists to deliver vaccination services. Also, guidance on how pharmacists may build vaccine confidence and communicate vaccine value by addressing and resolving concerns that are commonly presented to pharmacists about the effectiveness, the safety, the appropriateness of being vaccinated. Also by providing, by organizing regional events and identifying what are the main challenges and enablers for pharmacists to play a role in the vaccination area, or providing also more recommendations and technical guidance and professional standards in terms of, for example, co-administration of influenza and COVID-19 vaccines, or the recommended vaccines for the various special risk groups, for example. More recently, in September this year, our council, which is our General Assembly, adopted a statement of policy on the role of pharmacists in life course vaccination, which includes a set of recommendations for various stakeholders, including our member organizations and individual pharmacists, also academic institutions, and above all, it includes a set of recommendations for policymakers to leverage pharmacies and pharmacists to provide access to vaccination services, to remove barriers such as the requirement for a medical prescription for the administration of vaccines. When clear eligibility criteria are in place, pharmacists can prescribe and administer these vaccines. And this greatly simplifies the pathways for people to access these vaccination services. So other documents that we have developed, for example, this one was developed by our professional regulators advisory group, which functions under the umbrella of FIP. And it's a self-assessment tool, a regulatory self-assessment for professional regulators that can identify the elements that are described in this document, whether these components of a regulatory environment that facilitates and enables pharmacists to provide these services, whether they are present or not in the regulations in their countries. And when they are not, then the document provides a suggested language that can be used and adopted and adapted naturally to develop this regulatory framework. Other tools that we have developed to support the advocacy work of pharmacists and pharmacy organizations include this policy enabler toolkit that was released this year, and also that provides country models and also policy enablers and barriers and solutions to address these barriers in terms of vaccine regulations and prescribing, service remuneration models, and also access to data and vaccination records. And this is a premiere because this document will actually be launched tomorrow. And so you're the first ones to actually know about it. And this is a new report that we'll be launching that compiles case studies about recent developments in pharmacy-based vaccination, where new countries have introduced pharmacy-based vaccination or have expanded the role of pharmacists, whether that's in terms of the range of vaccines that they can provide, or the age groups they can vaccinate at pharmacies. So there's a very interesting compilation of learnings and success stories that can be shared with our countries. It also includes a report from a meeting we organized with countries that are facing challenges in introducing pharmacy-based vaccination. And so we brought these countries together so that they could share the challenges they are facing and also the solutions that they are working on to overcome those challenges. So this will be released tomorrow. Also to be released in the coming days is a new campaign, which is called Let's Talk About Vaccines. And this is a campaign addressed at community pharmacies. We developed a set of material for pharmacists to provide advice to patients coming from specific population groups, including older adults, people living with diabetes, with chronic respiratory conditions, with cardiovascular diseases, pregnant individuals as well. So, and also a set of materials that pharmacists can provide to patients, like flyers and posters that can be displayed at pharmacies with key messages and raising awareness about the benefits of vaccination among these groups. So, this campaign will also become available in the coming days, early next week, on the FIP website. But also, I mean, I've described a lot of the work that we've been doing, led by FIP and the resources we have developed. But we know that we cannot work alone and in silos. So, a couple of examples of how we work together with other organizations in collaborative advocacy. Um, One of them was this commitment by pharmacists, and this is an FIP-led document as well. It's a FIP commitment on leveraging pharmacists to build vaccine confidence and address vaccine hesitancy and complacency. But we invited external organizations, global partners, to endorse and to recognize and support this role by pharmacists. And this was supported by 23 international organizations from a variety of sectors, from IFA and ILC and other organizations representing the interests of older adults, but also immunize.org or FIGO, the International Federation of Gynecology and Obstetrics, or the International Diabetes Federation, the International Primary Care Respiratory Group, cancer organizations, public health organizations, so a variety of partners that support and recognize this role. And another one is, of course, an initiative that is supported by Pfizer that brings together a series of organizations, including IFA and the World Federation of Public Health Associations and the International Longevity Center, UK. So a number of organizations from different sectors that share a common goal of improving vaccination coverage across all ages. So this Immunization for All Ages initiative was set up several years ago. I can't remember exactly, but about 2017 or 18. And we have developed a manifesto with these three pillars that you see on the screen. And we do a common, it's a common platform for advocacy to policymakers, to governments around the world, to international global organizations on how to improve and prioritize investment in prevention and in vaccination, and to remove barriers to access to vaccination services. So these are some of the ways in which FIP and pharmacists have been advocating, but I would like to share with you some of the outcomes of this work that make us proud, and of course they're not only attributable to FIP, but it's this driving this driver that we have to see these outputs happening around the world. What we see, for example, is that there's a consolidated trend towards more and more countries introducing pharmacy-based vaccination around the world. We see that there's at least 48 countries that we know of so far. And we see that 12 of those were actually introduced in 2020. So there's a very clear trend towards this. And also we see, for example, in the US, the number of states that where a pharmacist does not require, that the pharmacist has the authority to prescribe vaccines. That's the darker shade of blue. And then in the middle shade of blue, pharmacists can administer the vaccine via a prescriber-approved protocol or non-patient specific order. So basically, also pharmacists would have prescribing authority to initiate the vaccination of these individuals. So these are very interesting. Also in Canada, we see this happening in many provinces with and for example, these pilot projects in Portugal, where when pharmacists were granted prescribing authority and there was no out-of-pocket payment, that we saw a 32% increase in vaccination coverage. And here in Ireland, for example, that we see that from the moment that pharmacy-based vaccination was introduced, not only the vaccination at pharmacies increased, but also the vaccination across all providers increased. And the result was a higher vaccination coverage rates across all sectors. In France, same thing. We see that from the time where the initial pilot was introduced in 2017, the authority of pharmacists to vaccinate was expanded to multiple vaccines, and now also not only to administer, but also to prescribe those vaccines. So we can see these very interesting examples. And I thank you very much for your attention and look forward to a discussion later on today. Thank you.